Kia ora koutou katoa. Good afternoon, everyone. Before I hand over to Dr. Mclennay, I thought I'd share some good news. Yesterday was another record day for the vaccination program, with 87,772 doses administered. We also hit another key milestone, with now more than 3 million doses having been administered since our vaccination campaign began. And yesterday also saw the largest number of bookings made in a single day through Book My Vaccine, with more than 270,000 bookings entered as we opened up the 30-plus age band. That means 73% of New Zealanders aged 30-plus have now either booked or had at least one vaccination. If you haven't booked yet, please play your part in keeping New Zealand safe from COVID-19 by going to bookmyvaccine.nz and make your appointment now. It's free and there are slots available. I'm now going to hand over to the Director of Public Health, Dr. Carolyn Mclennay, to talk us through the latest case numbers.
Thank you, Prime Minister, and kia ora koutou. Today we are reporting 68 new community cases since 9 o'clock yesterday. There is also one new case in a recent returnee in managed isolation. One previously reported community case has been reclassified after being confirmed as a false positive. This takes the total number associated with this community outbreak to 277. Of those 277 cases, 263 are in Auckland and 14 are in Wellington. The two new Wellington cases are household contacts and have been in isolation throughout their infectious period. There are currently 6 sub-clusters identified with the outbreak, the two largest being the Birkdale Social Network Cluster, which is associated with the original Case A, that has 35 confirmed cases, and the other cluster is the Mangere Church Cluster, that has 114 confirmed cases. The remaining clusters have fewer than 10 people associated with them. Since our last update, there has been an additional 20 locations of interest identified across the motu. That brings us to a total of 495 locations of interest, but only 3 new locations of interest added today. One location, a rugby game, was added today that was pre-lockdown. And we've had 2 supermarkets that have been identified as post-lockdown. Please remember to regularly check the Ministry's website. We are updating the locations of interest automatically on a 2-hourly basis. On contact tracing, the number of contacts continues to increase as expected as we identify more cases and continue to test in large numbers. Public health staff across the motu continue to focus on higher risk locations. As at 8 o'clock this morning, 24,402 individual contacts have been formally identified. And of these contacts, 65% have been followed up by contact tracers and the individuals are self-isolating. Approximately 71% of all contacts identified have had a test, and that reflects the high level of testing, particularly in some large settings such as schools. In these instances, communities have been directly informed by the local public health unit that they are contacts and need to have a test. Work is underway to contact the remaining 8,647 contacts. Half of those contacts were identified yesterday, so there's still, it's a timing issue. We also continue to significantly increase our contact tracing workforce. Yesterday, an additional 100 contact tracers were trained across government agencies and call centres. More staff are being trained today, and we expect to have in total nearly 1,400 contact tracers in call centres across New Zealand by the end of the day. On testing, yesterday was another big day on the testing front, and laboratories processed 41,739 swabs nationwide. In Wellington, that number was 3,303. In Wellington, there are 11 community testing centres operating today, including around 32 GPs open for testing. Testing centres in Auckland also had another busy day, with over 20,000 swabs taken across the city, with around 7,000 at community testing centres and around 13,000 at general practice and urgent care clinics. In Auckland today, there are 23 community testing centres open for testing. That number includes 5 restricted access testing centres that are for invitation only for high-risk groups, and that allows us to prioritise essential workers. There are 6 regular community testing centres and an additional 12 pop-up testing centres, including a new pop-up testing centre at Tuakau in South Auckland. We are expecting it to be another busy day today, so please be kind when you go for your test to our hard-working testing staff. I would remind you that testing is also available at general practice and urgent care clinics, and just a reminder that wherever you go, COVID-19 test is free. To help speed up the process at our testing centres, it's really helpful if you know your NHI number and if you bring that with you. You can find your NHI number on a hospital letter or on a recent prescription, or call 0800 855 066 to find out what your number is. A reminder that it's essential that people only get tested if they are a contact or if they have visited a location of interest at the specific dates and times and have been told they need to get tested, or if you are symptomatic with cold or flu-like symptoms. Whole genome sequencing, ESR has now run whole genome sequencing on samples from 152 community cases. The analysis of those samples has determined that they are all linked to this community outbreak. On wastewater testing, ESR has also now analysed, or is in the process of analysing, samples from 97 locations taken from 70 locations in the North Island and 27 locations in the South Island. That covers an estimated population of 3.8 million people and more than 90% of New Zealanders connected to reticulated wastewater systems. COVID-19 has been detected in samples from the Christchurch catchment on Saturday and Monday. That follows previous negative results last week, but ESR does stress that there are 3 active cases in Christchurch managed isolation facilities, and that is consistent with the virus being shedded from those cases. Further sampling from around Christchurch is being undertaken today, and we'll get those results by the end of the week. All other South Island sites continue to be negative. Further samples are being collected from Warkworth following a second positive detection. And just back to Wellington, COVID-19 continues to only be detected at Moa Point, and this probably reflects the known cases shedding the virus into the catchment area. There are no new results to report from Auckland since yesterday's update. And just lastly, we are adding another way for people who have been vaccinated to monitor any symptoms, and that is the post-vaccine symptom check. We already monitor reactions to vaccines and medicines through the Centre for Adverse Reactions Monitoring, or CARM, which works closely with MedSafe. But today the vaccine team will start sending out text invitations to a random sample of people who have had their vaccinations around 6 days ago. And that invitation asks the person to participate in a short survey. These text messages will be going out every day to a different group. If you receive a text message, you can opt out, but I would encourage you to participate. This really helps give us a better understanding about the use of the vaccine and the effects of the vaccine in a New Zealand context. Any information that we collect will be gathered and published on the MedSafe website. Thank you very much. Back to you, Prime Minister.
Thank you, Dr. Mclennay. So, as you heard today, we are in a very similar place to yesterday. With Delta, these numbers are not necessarily unexpected. It's more infectious, and we know it moves faster. So even though we moved into lockdown quickly once we discovered it, we should expect to see the impact of it being in our community for roughly a week or more prior for a time to come. I'll speak a bit more on that in a moment. First, while we can't give you a lot of detail about today's cases, given they were reported to us just this morning, I do want to share a little bit more about the ones that were reported yesterday to give you a bit more insight into what's happening with this outbreak, and we'll look to try and do that on a 24-hour cycle as well. Of the more than 60 cases that were logged yesterday, I'm advised that across all those cases, as you've heard, there have only been 3 new reported exposure events, as in places where those individuals were while infected with COVID. That tells us something really important, that people are following level 4 and that we're beginning to reach people who have become infected since lockdown began. We also know that 37 of the cases were from within households that already had a case. As we've said with Delta before, the rate of transmission in households appears to be high, and that's what's happening here. Also, of those 60 plus cases, our public health team have linked the majority. 16 remain under investigation since the interviews that were just taken yesterday. And finally, I can report that across the roughly 400 plus locations of interest that are reported on the Ministry of Health website, 13 currently have generated additional cases. So that's just to give you a sense that while we do have a large number of locations of interest, and we do want all of those individuals who are connected to those locations of interest to follow the health advice, at this stage roughly 13 have had cases transmitted at those locations of interest. We'll keep a watch on that and look to share a little bit more detail on that in the future as well. So while we've had a number of new cases today, that gives you a bit of a sense of the patterns that we are now starting to see, and that overall lockdown is having an impact. Firstly, we haven't seen spread beyond Auckland and Wellington, where there is a known link to the Auckland outbreak. If it weren't for lockdown, I'm sure we would have seen cases spread further. Lockdown is also having an impact on locations of interest. While our cases are continuing to grow, these locations of interest aren't continuing to grow exponentially alongside them, and that's because people have been staying at home. And finally, we're seeing lockdown's impact on our numbers, but there is no doubt that Delta is changing the way those numbers look. Previously, when you went into lockdown, anyone who might have had COVID but wasn't yet infectious to others was suddenly put behind closed doors, and that stopped entire chains of transmission. With Delta, people are infectious much sooner, and they appear to give it to more people. So our lockdown helps stop transmission outside of households, but we can expect the lag time in our numbers to potentially be longer and bigger. As I said, nothing at the moment appears to us to be necessarily unexpected, but we do need to be incredibly vigilant. You will have heard us say many times before, Delta has changed the rules of the game, and that's why we changed our game plan. We moved straight into level 4 within roughly half a day. There's been a massive increase in testing, mask wearing requirements. We're treating a larger number of people as contacts, as you've heard, in fact, over 24,000 people. COVID changed, and so did we. In fact, part of the reason I think the team of 5 million has managed COVID as well as it has to date is because we've all been willing to listen to experts and we've been willing to adapt. Right now, the experts are telling us to take on Delta differently, but they've also told us to stick with the elimination strategy for now. In their view, it's not only possible, it remains the best strategy, and I totally agree. Elimination means continuing to stamp out COVID wherever it emerges, and all the while ramping up our vaccine program and ensuring every eligible New Zealander takes up the opportunity to be protected. That's because vaccination provides everyone with their own individual armour. Previously, when we didn't have vaccines on offer, we relied on turning our borders into that protection. And when there was a chink in that barricade, using lockdowns to get an outbreak under control again. Our collective goal is to move away from having to use these measures in that way, and vaccines help us do that. No one wants to use lockdowns forever, and I can tell you now that is not our intention, as we have new tools for managing COVID, and we will use them. But for now, while we vaccinate, elimination is the goal, and we can do it. I know there have been a lot of commentary on our strategy versus other countries' strategies. You might have heard me to respond to those questions by saying that I'm not fussed by such debate. For me, and I'm sure many of others, the measure of success in this pandemic is not just what happens in August of 2021. It's what's happened since February 2020 when COVID arrived in New Zealand. Then and now, we had 3 goals. We wanted to save people's lives, and we have. We wanted to try and have people's lives lived as normally as possible. And even now, we've had some of the shortest periods of restrictions of any country. And we wanted to save people's jobs and the economy. With unemployment at 4% and the economy performing at pre-COVID levels, we've done that too. I know the battle with COVID is not over. It won't be for some time to come. And that's why we will keep changing up our strategy with those 3 things in mind: people's lives, their livelihoods, and the ability to feel as normal as possible. And on those measures, the team of 5 million has done an amazing job. Nothing about this outbreak changes that, and if anything, it probably only strengthens our resolve. So to wrap, a few quick important reminders. To date, everyone is doing incredibly well with level 4. Compliance is really impressive, so a huge thank you. But case numbers are a daily reminder that we cannot drop the ball, so please minimise your contact with others. Any interaction you have with someone new outside your bubble could be someone who becomes a positive case. Unless you are an essential worker, you should only be going out to get food and to exercise. Obviously, if you're symptomatic, we want you to be tested. And if you have a vaccine booking, of course, we want you to take that up. If you're awaiting a test, though, please, no departing from your home. And in both cases, of course, across the board, always act as if you might have COVID. If you're an essential worker, we need you to be constantly checking the locations of interest and checking for COVID symptoms. The worst thing you could do is go to work without realising you're now a close contact, or worse, take COVID to your work site. If you're isolating and need help with food or anything else, please let those making welfare checks know and ask family, friends or neighbours to get your shopping for you and drop it off in a contactless way. So as a team, we need to stick together and get the job done. And the most important thing you can do to avoid future lockdowns is get vaccinated. And then once we have been vaccinated, support everyone you know to be vaccinated. If you're 30 plus and not yet vaccinated or booked, please book today. We need every member of our team to play their part. We're now happy to take questions. Yeah, Jenna, and then Mikey.
Given you said that Delta is infectious much sooner, but it seems to be sticking around for longer, do you think that you are going to have to keep Auckland at a higher alert level for longer?
Obviously, we'll be looking to make those decisions on Monday. But as you can see, a high rate of cases, and that is not because there is any issue with lockdown and its success. We can see it as having an impact, but Delta is very, very tricky. We know that it appears to be, and research is telling us, and this seems to be our experience, that you have an earlier period of infectiousness than what we had before. And we also know it's more infectious. So it's to be expected that we would see a bit of a lag before necessarily seeing the full impact of our lockdown. Dr. Mclennay?
Yes, and certainly what we're seeing with the cases coming in completely justifies the lockdown, because those people were infected before lockdown. They weren't aware that they were a case, but they would have gone on to infect others had we not had a lockdown as a control.
Yeah, so definitely making a difference, there's no question.
The fact that we haven't seen any cases in the South Island,
yep.
Are you pretty confident that COVID hasn't made its way Delta?
Oh, look, we're very pleased at this stage to see that swift move to level 4 has meant that whilst we have, of course, a very mobile country, we haven't seen cases down in the South Island. But we look for other measures, of course. We've got good rates of testing. What's the wastewater looking like? And are we confident that we can safely move in that area? Those decisions we'll use with the very latest data, and we'll be looking to make those decisions tomorrow. Mikey.
You've said that New Zealand won't use lockdown forever
Yeah.
while encouraging vaccination. So what level of vaccination across the country would you be comfortable with before we abandon lockdown?
I want the highest number of people vaccinated as possible. Not only because that gives us the best chance at maintaining, a level of normality in our lives, that's what protects those people's lives. And that's got to be our collective goal, to look after the team of 5 million. So every extra person that gets vaccinated saves them, saves someone in their whānau, someone in their community, and prevents the risk of outbreaks. People have asked us for numbers. The experts have really advised us to stay away from a single number, because that won't necessarily give you the level of detail we need around, for instance, what percentage amongst an age group, an ethnic profile, or even a town or community. We need the numbers to be high across all of those measures. I'll let you finish, Mikey.
Yeah, and so knowing that one of the people infected with the COVID-19 virus this time around is yet less than 1 year old,
Yes.
what do you say to parents who may be frightened when you mention a lack of lockdown for their young children?
Well, the whole reason we want everyone who is eligible to be vaccinated is because then they can form a sort of barricade for those who aren't eligible to be vaccinated. The more of us who can be, who are, mean that we act as a form of protection for those who are too small and too young to be vaccinated. And that is why it's so important.
But even those who are vaccinated are still being infected with the virus and can also pass on.
Well, I think, yes. I mean, keeping in mind, we haven't got large-scale, widespread vaccination yet, so I don't think it's fair to judge too much about the movement and transmission under those conditions. And yes, while we do have what's called breakthrough transmission, which is not unexpected, you're not seeing those individuals incredibly unwell as you might for unvaccinated individuals. But I'll let Dr. Mclennay comment on that too.
And just to add that what we're seeing from the international research is you can get infected if you have been fully vaccinated, but the likelihood of being infected is dramatically reduced.
But I guess the question is that, those who can be infected may pass it on to younger children, and what do we know about that?
But your likelihood of becoming infected when you have a large portion of the population vaccinated, of course, is much reduced. So we have a duty, not just in order to look after ourselves, but to protect other people who aren't eligible for vaccination by being vaccinated. The other thing I'd say is, look, our plan is very clear. For now, elimination is the very best strategy for New Zealand. We will continue to look at the best evidence and expert advice possible as we transition into the new year with a vaccinated population and make changes to our plans. But it will always be based on those measures. How do we save lives, live as normally as possible, and keep our economy ticking along well?
Just on the long
I'll come to you in the front, yeah.
Just what
Jason.
you were saying at the beginning about the lag period, and correct me if I'm wrong, you're talking about the fact that the virus was active within the community for a week. So this is what we're seeing now is the impacts of it being in the community for a week.
Yeah. So I'm going to have a go at explaining two things that we think might be making a material difference. One is simple. It's just the level of infectiousness of Delta. The second is, yes, we obviously believe that this case came into New Zealand on the 7th, and somewhere between, say, the 7th and the 9th somehow entered into our community. And, of course, we went into lockdown, some 8 or so 9 days ago. So, yes, there was a lag there. That's one of the things. But the other thing that there's already evidence to suggest is that previously with variants like, say, Alpha, from the time someone was exposed to someone who had COVID, say they went to another event they were at, to the time that they might potentially infect others was somewhere in the range of 5 days.
That's right.
So that gives a lot of time for testing, contact tracing, and then removing people who might infect others. We're now seeing data that suggests Delta, it might be more like 3. Some public health units are reporting shorter windows. So that is another reason why actually a lockdown, whilst it takes people out, the number of people that they may have infected in those windows will be greater as well.
Right, so what we're seeing now is obviously what you were talking about last week, that peak. So from now on, are you expecting to see the effects of the lockdown? So we're going to see fewer and fewer cases day by
Well,
day?
we're seeing the effects of the lockdown in the sense that we're seeing fewer locations of interest. Of course, you're still seeing household contacts. But, of course, I don't feel ready to make a judgment yet on where we are in the cycle, in part because certainly it doesn't mirror alpha. So I'm hesitant to do that myself. So perhaps Dr. Mclennay may hedge your bets on that.
Certainly the modelling that we have supports that we're now at that period where we'll start to see the peak number of cases, and we would expect that to flatten off and then start to go down because we're washing out of the system those people who've already been infected.
So today, we're going to start from today or tomorrow, we're going to start seeing a little
It's a little of unfair specificity you're asking for.
I wouldn't like to make a prediction.
But one thing also that I'm very mindful of, we have a large number of households affected here, and a portion of those, yes, even just yesterday, 37 from within the households. There are a number who have not yet tested positive, so as grim as it is, I wouldn't be surprised if we see numbers continue to be high because of those household contacts. Do you mind, Gina, if I just pan around a little bit and then I'll come back to you? The modelling isn't suggesting that, but we'll see. Yeah, Joe and then Luke.
So Dr. Bloomfield indicated this morning that there had been an update in terms of the source investigation. Are you able to give any details about what that link is with the person in the Mangere cluster, where it might have come from, and just any other information you have on that?
So what he referred to was a possible link between someone who was very early on in that outbreak, who's tested positive and has been connected to a number of locations, and potentially then another missing link that then connects to the Crowne Plaza. The person who the theory stands might be the missing link has tested negative twice, and their entire household has also tested negative. So it's not something that we're canvassing widely because at the moment the evidence there isn't strong because the theory doesn't necessarily demonstrate the evidence required to show a link. So it's hard to say the person is the link when they've tested negative twice.
But can you explain why that person was identified, regardless of the fact that they've tested negative? Why have you honed in on that? And what can you
Just
do?
because of the connection to the Crowne Plaza. But as I say, they've tested negative twice. No one in their household has tested positive. They've undertaken serology just to be sure, but it was a theory that at the moment some say are calling unlikely. But this just demonstrates we are following every lead because we do really want to figure out what's happened.
And yes, I'd just add to that, it reflects the detective work that happens for the... so we have a case that's got the earliest onset in the community, and that's where the public health unit explores all possible avenues, connections that there might have been, and that's where then they follow that up to see what evidence we can get. So that's the
best way I can describe it. That person that Dr. Mclennay is describing, who was early on and at a location of interest, someone else at that location of interest is connected to the Crowne Plaza, but that person has never tested positive for COVID. So that's the explanation I can give at this time. And if we have any other evidence that provides greater support for that theory, we'll share it with you. But we're awaiting serology at the moment, so we'll see what that shows us. I said Luke, and then I'll come over to Claire.
I think as Steph said yesterday, I think it was 270 rooms at the Jet Park.
Yeah.
Obviously 263 cases in Auckland.
Yep.
How many more hotels are you able to bring online? What's the total number of rooms that you're going to be able to throw at this?
Yep.
And if there's more cases than rooms, what's the plan there?
Yeah. So we treat households, in some cases we'll have households where people will isolate together, and in some cases we'll have positive cases and then we'll isolate their other household contacts separately somewhere. So we have an additional facility that was brought on to house household contacts in order to separate them. We're also bringing on another facility that will come online tomorrow in order to give us greater capacity. So whilst I can't give you some of the specifics of those numbers, I can tell you we are bringing extra facilities online. We're going to do a little bit of a stock take of how our numbers are looking over the next 24 hours to assess what else might be needed.
Can we find out how much capacity there actually is in the system, and if there isn't enough, what is the plan there?
Well, as I've said, an additional facility for household contacts. I can't give you a number on that one, but that is a specific facility for that purpose, and we've got an additional 200 rooms coming on tomorrow.
And can you confirm that there have been no cases of transmission from one person to a person outside of their household since the lockdown has come in place?
So some of the cases, of course, that we're detecting were infectious pre-lockdown, and so we'll have passed it on pre-lockdown, but will have been detected. But will have been detected after lockdown.
Yeah, is there any evidence of any cases that were passed on post-lockdown?
Right. That have been infected post-lockdown and passed it on post-lockdown.
Post-lockdown, we're not aware of any new cases who have been infected in that location after lockdown.
Yeah, and then passed it on, yeah.
Yeah.
The church at the centre of the big cluster in Auckland thinks the ministry could do better with its communications with Pacifica people. Do you agree?
I'll let them. Look, if someone from the community is telling us that we need to improve communications, then I take them at their word on that. Obviously, there are things that we can do to improve there. I know there's been a lot of work, particularly with some of our fantastic Pacific providers who are doing a lot of work to help improve some of the welfare response, improve some of the communications, and just ensure that those families we're working with have everything that they need.
And I've spoken to the public health unit there. They're very aware of the need to have really good engagement with the community, and they're utilising all the resources to help them do their job, but also to ensure that the community understands what is required of them.
Why is it taken until now? We've already had an outbreak that's affected the Pacific community predominantly.
Well, of course,
why did you not learn from
there's
that?
been communication the entire time, but of course if we're getting feedback that some of it needs to be improved, then we take on board that feedback and will of course look within the situation to keep doing better at every turn. One thing I will say is that we have individuals split across multiple congregations. I think that has posed some complications, but it's no excuse. We always need to try and do the very best we can to make sure we're getting information to those who need it as quickly as possible. But I've heard some really heartening things in the last few days about how some of that those relationships have really strengthened over the past few days.
And just quickly on that,
I'll let you finish there.
just quickly on that Warkworth case that was mentioned yesterday,
Yeah.
do you have any more details on that? Does that case have links to Auckland? If so, how?
So it is linked to the cluster.
Yes, the information that I've received this morning is there is a link with the large cluster. There's still a couple of potential links, but they've definitely identified links to the cluster.
And there were no locations of interest listed in Warkworth as yet? They're not gone anywhere?
They're still working through with that case, is my understanding. So there may not yet have been any locations of interest, but they're still working through the interview with that person.
Yep. They were, of course, infected in Auckland, so, of course, may factor in when they actually, in fact, travel back to Warkworth. Sorry, I meant to come to you, Claire, wasn't I? No. You always sit in the corners of the room.
Will you be releasing the 13 locations
Yes.
that
Yeah.
have come from? And also, do you know how many of the contacts who live outside of Auckland and other regions have had tests so far and they're negative?
Yeah, so of course we do record how many of those have returned tests. Of course, some of them have different dates that they're meant to be tested on. So I'd need to ask the ministry to break down that data by those who have an address listed in the South Island.
Yes, we can provide that data.
Yeah, and that's data that we will look at as we consider our decisions, for instance, on Friday. On the 13 locations of interest for where we've had, where we know that we've had transmission at those locations, yes, it is our intent to share those. The only reason we haven't today is what we want to do is a little bit of analysis as to whether or not where that transmission occurred, they were known contacts for one another. So, for instance, were they seated next to each other? Were they at the social event together? Because some of those different events might be quite large, and we don't necessarily want to trigger everyone to react in a particular way if they don't need to, just because they were at that event. So we're going to build a bit more of a picture around each of those locations and then share that information. Yeah. If you mind, I'll come to Ben and then I'll come to you. Yeah.
Thank you. Just zooming out a bit from the current outbreak here, the World Health Organization says countries should delay booster shots for several reasons, but mainly to allow lesser developed and poorly vaccinated countries to where people are dying to access vaccine. In principle, does New Zealand support the WHO position here?
Oh, you will have heard me and everyone really within the government say, and of course the Ministry of Health and all of our experts, we're not safe in New Zealand until everyone is safe. We know that variants thrive in areas where you have low rates of vaccination and significant outbreaks. And so we are all going to be better off once we have a good level of baseline vaccination globally. On the issue, so that's one reason. On the issue of booster shots, I know people are really interested in the evidence around whether or not we've got issues with vaccines waning. The jury's really still out. We'll keep analysing all of the data and information, and we keep up our conversations with the drug companies regardless, because actually we'll have an ongoing need for vaccination programs for those who become eligible. So that's one of the reasons we keep those talks live.
Once you settle on whether you want booster shots, will you attempt to get at the front of the queue like last time? Or will you say, prosecute that argument that says no, others will?
Well, we have always tried to do both, serve the needs of our population as we have a duty to do, but at the same time make contributions to COVAX so that the rest of the developing world has access to vaccines, donating as we have to within our own region as well, helping facilitate the rollout in the Cook Islands, in Tokelau and in Niue. We've supported their vaccination programs. And even now we're continuing talks with the likes of Tonga and Samoa over ongoing need as they roll into some of the younger populations too. Yes, yeah, go ahead.
On the locations of interest, one is Countdown Westgate at a time that the supermarket's not open to the public. Can you clarify if a Countdown worker was infectious on shift? And is the Ministry of Health government looking at introducing rapid at-home tests as they are in New South Wales to get ahead of Delta?
On the specific question about the supermarket, I won't be able to answer that detailed question here, but if you send that through, we can provide the details for that. There have been a number of supermarkets who've been identified post-lockdown as locations of interest. And in relation to your last question, we continue to look at the evidence around all sorts of testing, including rapid antigen tests. We haven't yet provided a conclusion. The evidence is emerging around the world about that, but we continue to keep a close eye on things.
The one thing that we were advised before we came down is that with the supermarket worker, they were infected within a cluster within the outbreak as opposed to being infected in their place of work by someone else, if that helps. Yeah, Mark.
How many cases have there
Sorry, then I'll come to Luke.
How many confirmed cases have there been in essential workers in the outbreak so far?
So we've had, you will have, forgive me if I don't have a number, but we have had, as you will have seen, the reporting around the nursing workforce. We've got a supermarket worker. We have had some who work, of course, in level 4, there's a restricted number who are able to work. We've had some who are not customer facing, but who work in food and beverage production. Those are all places of work that in order for them to operate at level 4 have to have quite strict infection prevention controls. So those are all things that are assessed by our public health teams if they have a case in those locations as to the use of those. So perhaps Dr. Mclennay would like to comment on that.
Just to add that the under a level 4 arrangement, there was a lot of preparatory work to make sure that the settings are safe for those essential workers, because that's always been realised that that is a potential, that one could have someone who's an essential worker who is infectious whilst they're doing their role. So that's been something that we have emphasised from early last year, that we need to have good mechanisms in place to make sure that those workplaces are safe, not just for the workers, but also people who may be using those workplaces, for example, supermarkets, which is why we've got the procedures in place in supermarkets, for example.
And are there any unlinked cases or cases of essential workers that are giving you cause for concern that level 4 might not be stopping all transmission outside of bubbles?
We've had, so from yesterday, we've been notified of, and I can't put these into that category or not, but generally we've been told from yesterday, given they've only had 24 hours, so often things will be linked later, we've got 16 at this present point in time. But every time we've asked the public health unit whether or not they have a concern that there are compliance issues or anything to demonstrate level 4 is not working, the answer I've gotten back has been no. So yes, they are still working on either linking to a person or to a location of interest. Not unusual for that to take longer than 24 hours. So I'll come to you, Luke, and then look away.
With benefit of hindsight, would it have been better to target Auckland for first shots of the vaccine program as opposed to rolling it out across the country, given that, if the borders were to close, that it would most probably be coming through Auckland?
The two things I'd say, well, we did. We actually, in the phased rollout plan, of course, when we said we want to target our border workers, we want to target our healthcare workers, we want to target those who are working at MIFs, that did lead to a large proportion in Auckland. And remember, we also brought forward the age cohorting for counties Manukau first. So we moved down into younger aged groups for counties before we did for any other part of the country. So that was to try and target those who are at the most risk, which by default meant more in Auckland. The other thing that I would add is, keep in mind, yes, we're very pleased that we haven't seen spread down into the south on this occasion, but we have in Wellington. We had 9,000 people just in the 48-hour period after we called for a lockdown who came from Auckland back to other parts of the country. So we do need to think about the fact that as a highly mobile country, actually having some resilience in other parts of the country was important too.
And just also, by our count, there's now been at least 5 locations around the country where Labour Party volunteers have continued to breach lockdown by delivering pamphlets, touting the government's COVID response. It looks to us like your electorate is now among them. Why has it been so difficult for the Labour Party to...
Yeah, I can.
How embarrassing is it?
Oh, it's really disappointing. Of course, we don't want this situation. Of course not. We want everyone to be modelling exactly what we need at level 4, and so we have taken a number of steps. Unfortunately, our leaflets are delivered by volunteers, wonderful, wonderful volunteers. But we have communicated with them via phone trees through our volunteer network, through email, through text message. We had the President just 48 hours ago send out another reminder to cease delivering any pamphlets that they might have. Unfortunately, we haven't always been successful in reaching everybody we need to, because we literally have thousands of people across the country who in their spare time deliver leaflets, but we have certainly asked people to stop.
Does it worry you that politically engaged,
politically
engaged volunteers aren't getting the message?
Let's be open. These are thousands of people who come from all walks of life, and I wouldn't necessarily say that put everyone into that category. And so, look, it's on us to try and reach those people. We have done a lot. MPs have individually engaged as well, but there are thousands of our volunteers. So yes, it is frustrating, it is disappointing. We've worked very, very hard to try and send that message to people, but human error amongst volunteers will from time to time happen. It's no excuse, but simply an explanation. Rukuwai.
Just a couple of things. And first, a follow-up from Jenna's pathway. Pacifica and Māori community leaders are telling us that this whole thing this outbreak within the Pacifica community could have been avoided if government engaged properly with the Pacifica communities. Does that just tell us that the vaccine rollout plan for Pacifica has failed?
Well, actually, I look very closely at our vaccine data, particularly across age groups, but also Māori and Pacific. Well, we know that we have to make sure we're working with our providers to reach our communities there. And what you see at the moment is actually across those age cohorts, really good uptake. So where we've opened up early on, you see, in fact, for the Pacific community, the same rate of uptake almost in almost all areas as you have in our general population. So the issue for us now is to keep that consistent. As we roll out, we've got to keep making sure that no matter what your age, we are reaching those members of the community. It is not done yet. So keep holding us to account, but make sure that we're also doing it once we're a bit further through the campaign.
Also, we asked the Ministry of Health about the data around vaccination rates for homeless.
Oh, yes.
The response was, it is unlikely vaccination rates for homeless and rough sleepers will be available to be monitored through data at a national level because no single database is set health for homeless and it can't be easily developed either. Is that good enough?
So what you also, look, I would have been provided with was the different providers who are undertaking vaccine campaigns. So we've got Auckland City Mission, LifeWise, and they will have their own numbers of individuals that are vaccinated. I've seen those numbers, and I believe we may have provided them. But what we don't have is a national data set that categorises people as homeless. And that's because no such data set in that way exists. People move in and out of housing, but they will be known by the housing providers. And so that's why we've worked with them, who know their community, know who they need to target, and they have been targeting them with their vaccination.
So we'd be relying on anecdotal data to...
No, we have numbers. We have numbers, and I saw them. I thought they'd been provided to you, but we do have numbers for each of those social providers on how many they've reached so far. But these are our chronically homeless.
Prime Minister,
Happy to. I believe that there won't be privacy issues in providing those numbers.
Come back to us at the ministry, and we'll see what we can provide for you.
Jason, and then Benedict.
My apologies if this has already been asked, but what's the plan with the next mass vaccination session at MIT? Is that still going ahead as planned, or has that had to be changed?
Oh, that was due on I want to say the 9th of September. I haven't seen anything further on that in recent times, so would you mind if I came back to you on that?
Not at all.
Yep, thank you.
Can we get an update on the rescue mission in Afghanistan, how that's going in terms of the numbers we've managed to get out so far?
I expect so. Our intention was to provide the final numbers at the conclusion of the campaign. And the reason for that is, so that we can consolidate, because, of course, we've been working with other international partners. Some you'll know have already arrived, some en route. The other reason is just for safety. You'll have seen a lot of international reporting around concerns of safety around the airport. We've been wanting, therefore, just to be careful about what has been communicated about NZDF's movements and the movement of our people en route to coming home.
Right, and for the people who are stuck near the airport, in the past they've worked with our Defence Force, doesn't look like they're going to be able to get on a plane. What's our government's advice to them? What should they do? So
we've got three groups of people that we'll need to continue working on our plans around from Afghanistan. The first is, once we have a final consolidation of those we're being able to support, we need to look at how many New Zealand citizens or visa holders may not have been able to be evacuated in those evacuations we've undertaken so far. And that may be because they're in provinces where it was simply impossible to get to Kabul airport. The second group are those who fall in the category having supported our agencies, who may not have, for the same reason, been able to reach our flights. And the third are just a wider humanitarian group, of course, who may wish to seek to be refugees in a number of countries that will be seeking to support those affected by this conflict. Cabinet intends, once we have a final consolidation of those that we've been able to evacuate, to then work through a plan for those who still remain.
We just to follow on that.
Yeah.
We understand 30 to 40 families applied urgently for visas through MFAT and immigration last week who met the criteria but haven't heard anything back yet. Why have these visas not been approved? Well,
the first thing is I simply can't speak to whether or not they did or didn't. We had, of course, quite clearly defined criteria that we were working to. First, of course, focusing on getting New Zealand citizens, permanent residents who were stuck there, also those who supported our agencies and Defence Force. And for those, we by and large, of course, knew and had awareness of who those individuals were. And then there'd be those who are visa holders that had already been issued visas but were in Afghanistan.
But is it now too late for those people who've applied for visas to get the visas?
To be clear, there will be those who had visas. There will be those who will be citizens who we have not been able to get out of Afghanistan. The window was very short. The number of people seeking to leave was enormous. I think it'll be clear at the conclusion of this mission that every country will have some people they weren't able to bring out, and most of us, of course, will then look to what the next steps need to be.
How does that sit with you? How does that sit with your conscience that we've got people over there that we can't bring home?
No one has gone in with the intention of leaving anyone behind, but the reality of the situation has been extraordinarily difficult. Not only did we have a very small window in which to try and evacuate people, we literally, across all international partners, there have been tens of thousands of people seeking to leave in very unsafe circumstances. Some of them had been in provinces where it wasn't even possible for them to travel to Kabul. So we've always known that we were going to need to look at what would happen after this emergency mission.
But all these 30 to 40 families are waiting for is someone at immigration to sign off on their visas. Is that good enough?
That is, Jenna, that is simply not a correct characterisation. There will be some who already have visas. There will be some who had passports who will not have been able to get out. And that is not an issue of processing. It's because they are in absolute turmoil in that country right now.
Vaccine passports. I've spoken to someone living overseas who's received both of their Pfizer doses here in New Zealand, and yet they're coming up against barriers over in the UK because we just don't have the documents that are.
We do issue them. So at the moment we do issue them. The Ministry of Health has a manual process where they do issue documentation for people who apply, and we do have a number of people who apply.
Is a letter good enough though?
Well, look, different countries will have different ways of presenting their data, and so yes, if you're in New Zealand and you're vaccinated by Pfizer, we won't necessarily then produce something that sits within the app that's produced by the UK government. And that's why in the long run, I think we're all wanting to see something that is digitally recognisable across a number of boundaries, because some people are not just using it at their borders, they're using it in country for events, pubs, clubs.
Can I just ask questions on behalf of colleagues, please?
Sure, and then I'll come to you in the front, yeah.
The saline slip-ups, how come it took 6 weeks in order for those to come to the public attention, and how damaging is this to public confidence of the rollout? And just on saliva testing, Whānau Waipareta wants to offer saliva testing to its wider community. Is the Ministry of Health going to approve the Trust using that?
Well, of course, saliva testing is already being used in our system. I think the thing to just note there is with saliva testing, it takes as long to process if it is PCR based. It takes as long to process as a nasal swab. There are other forms of testing that are rapid, but they don't have quite the same level of accuracy as the saliva testing that you process as PCR. But I'm sure more than happy for that dialogue to start. The more testing we can do, the better. On the issue of the saline, the most important thing here is that this wasn't an issue of anyone's safety being compromised. However, of course, it was not good enough that it took that length of time to tell people what happened and to offer them options. The reason for the delay, though, was Health was concerned about going and notifying people of something that had happened to a small number of people without having finalised what the best option was for them. They continue to seek clinical advice on what those options for people should be, but in the meantime, they've made contact with everyone, or are in the middle of doing so.
Worried about the impact it could have on public confidence?
No, I think that's why the first thing I would say is that this has not in any way compromised anyone's safety. This happened on a small scale, and no one came into any danger as a result. Dr. Mclennay, do you want to comment?
Just to add, as Dr. Bloomfield outlined yesterday, that after that event, that it sort of highlighted a number of extra checks and balances that needed to be put in place. Those have been put in place, and so that's part of our continuous improvement to make sure that we're just minimising any potential for any of these unfortunate situations to happen.
Patients that could have been affected argues that it
Jumping in a little bit there, Jenna. Just in fairness to everyone else, I'm going to go Joe.
Just on contact tracing, we know the Ministry of Health has got a standing capacity of 3,000 contacts a day and a surge capacity of 6,000. At the moment, across this lockdown, it's been averaging about 1,500. There's been 4 reviews into contact tracing suggesting from the likes of Sir Brian Roach that there's been an unwillingness from the Ministry of Health to ramp up that surge capacity. Can you genuinely happy with where that contact tracing is at when it is so far below the standing and surge capacity?
Well, I mean, looking at what we had yesterday and what we're looking to have by the end of the week, which I think the surge plan that I saw had up to 1,800 working across just those call centres. The thing that I would say is that even at the time those reports were written, we have now vastly changed the way that we're dealing with contacts. We've got 25,000 now, a much larger number because that's what Delta demands. Surged in capacity using other government departments in order to make contact. But already those contacts we're reporting are people that by and large have had either contact via their schools, via Healthline, via other forms in order to give them the advice they need. And then, of course, our practice has been to have regular follow-up phone calls. 25,000 is a large number of people to be dealing with, though. But Caroline, if I hand to you on that question.
No, just to agree. And actually what we have seen is that surging happen. And that surge has happened within 24 hours since when we saw that the existing capacity that was within the system needed some extra help. And that's part of the planning that was in place, that ability to then be able to pull in others and get that surge happening quickly.
But if surging happens, then you're suggesting that you've hit 6,000, which you haven't.
Sorry, we've hit 6.
Surge capacity, the Ministry of Health says surge capacity is 6,000 contacts. So are you suggesting that the Ministry of Health has reached 6,000 contacts at some point?
Well, we've actually, as reported, I mean, you will have heard Dr. Mclennay report over that number.
That's right, there's over 20,000 contacts.
Yeah, and it's over a period of time. I'm talking about a day.
Yeah, well, except, of course, some of those will come from one of, the locations of interest we're getting. Some of them will have thousands all reported in one day. And the fact that we've been able to bring in that surge capacity, you'll see that in one day of reporting, I think we had 4,000 come in just yesterday.
And it's the ongoing management of those contacts that's really important. So it's those daily calls to contacts. It's not just registering them into the system.
Okay, I'm just making the point that these are your numbers. These are the Ministry of Health numbers. We're not plucking them out of thin air. So are you trying to suggest that the Ministry of Health is at surge capacity and is contacting 6,000 of those cases a day over this period?
So one thing just, Joe, and forgive me, I'm just trying to understand that I've got your question correctly. For some of those contacts, they will be contacted on a regular basis because they'll be triaged as being individuals that may be symptomatic, may be of greater concern than others. Others, they'll be triaged by the Ministry of Health to determine whether or not actually we can maintain, once we've contacted them, given their instructions, whether or not they can maintain contact with one of those 25,000 through other means that isn't necessarily a phone call. Keep in mind the practice of our call centre and our contact tracing callers has been to maintain regular contact with 25,000 people across multiple days. That's a lot of calls, so they are adapting what they're doing. So that's why I'm just concerned that giving you a blanket answer on how we're treating a specific 6,000 people per day probably isn't an accurate way to deal with that question. So sure, I'm asked Health perhaps to give you a bit more of a breakdown of the number that they're contacting daily or doing symptom checks on regularly. Look, I'm going to just narrow down to some final questions, please, because we're over an hour now. Down the back. Yeah. Oh, sorry, Ben.
Dr. Mclennay,
Yep.
Do you have an update on how many close plus contacts there are? How many have not been reached yet? How many are waiting on test results?
Test results we're tuning through pretty quickly now.
Are you talking about the number of close plus contacts who we're waiting for test results from?
Well, how many there are?
Okay, so you want an update on those figures?
Yes. I'm not sure I've got those figures here with me, but we'll be able to give you those figures because they are regularly reported.
Okay, just everyone give an indication to Andrew if you want those figures shared with you. Perhaps we'll do it on the poll editor group.
Do you have an update on the number of the cases that are vaccinated, so versus second?
Yeah, so I saw that in the update this morning. The one thing I'd just add that somehow people seem to suggest that if you've got a vaccine that we should have more people vaccinated showing up in our cases. Ideally, you don't want vaccinated people becoming infected with COVID. So it doesn't mean that because we don't have more that somehow that's a reflection of a failure of the vaccine campaign. It's perhaps indicative of the fact that the vaccine is working. Last I saw we had something that was over 14, but let me search through while I ask for another question in the front. Ben?
So just to take you back to Afghanistan, obviously
Yeah.
there is the need currently to get our citizens to get out water, otherwise it needs energy. After that deadline, where is your thinking at in terms of refugee intake? Is this the sort of generationally significant moment that would cause New Zealand to sort of lift its eyes a little bit and take more people?
And this is the very question that we as a Cabinet want to have a discussion about, because I talked about those three groups. There are those that are stuck that we need to continue to help and support to get out. There are those who we already identified as having worked with New Zealand that we may not have seen come through already. And then there's just broadly the humanitarian effort. And I do think there's work to be done across the international community to see that there is going to be that support, but we'll have a particular eye on those who, because of perhaps their human rights work or others that we would have concern about. That does involve the UNHCR though, so often is a slightly longer process, and we want to work on that next. Sorry, well, of course, we've already doubled our intake, but no decisions on any of that have been made. It would be premature for me to speculate on that. I'll come back to your last question. We've had 34 have had their first vaccination, 10 on their second.
So just another follow-on.
No, I am going to stick, if I may, I am going to ask for another question here because we haven't had many on the side. Yeah.
Two questions from my colleagues, Mr. Mclennay. Firstly, how many intensive care nurses are we short around the country? Is it as many as 100? And secondly, does the Ministry of Health know exactly how many doses of the vaccine have been discarded or unused for whatever reason, following Chris Hipkins citing we were using 99.5% of our stock?
Just to answer your last question first, I don't have the specific percentage, but it's a very small percentage of discarded doses. Very small. I would say about 1% or less than 1%.
We're well under the international wastage rates from memory, right. And we also order factoring in what we saw as average wastage rates across the globe. But yeah, my memory is it's very, very small.
You're
looking for intensive care nursing?
Intensive care nursing. I don't have the figures as to the number of intensive care nurses, but it is part of the planning that the ministry has been doing to be able to make sure that we've got the staff as well as the facilities for intensive care provision. That is certainly part of the planning and is ongoing work with the DHBs.
How many are you planning for? Like, what's the gap that you're planning for?
I don't have those particular figures. That reflects my area of expertise, which is public health, which is not in the intensive care treatment side, but we can get those figures for you from the Ministry.
What I can tell you, the Minister of Health gets, I believe it almost might be daily, he gets reports on what our capacity is across our hospital network, including in our intensive care system. So he's constantly looking that we have the capacity we need, particularly during winter months. We know that RSV caused a surge. He suggested to me this morning that we're starting to see that abate a bit. But particularly of concern to make sure that we've always got the paediatric care that we need, because we do have, single centres of excellence for that in New Zealand. So that's an area we always keep an eye on. I'm going to come here, yes. And then you are going to be my last question.
Yeah. A targeted approach for Pacific and Māori youth and young adults in particular?
Yep.
Quite an important age bracket.
Yes.
Given their younger age structures, is there a targeted approach to those?
Yes. So we have, for instance, with our vaccination campaign, I'll speak specifically to the Pacific program, $16 million there to support both building Pacific capacity so that we've got the workforce that we need, working with specific providers to build capability to lead on those programs, comms efforts. In fact, the likes of the Cause Collective and others who have been involved in some of those, building some of those campaigns. So there has been a lot of work to reach out into community to help build those programs. And the last time I visited a vaccination site, I saw some of our Pacific providers helping lead the delivery of vaccination programs in the area, and it meant that they were bringing in really innovative ideas on how they would roll out. Did you have any further on that, Dr. Mclennay? Okay, I think we'll wrap there today.
One on Afghanistan. The US plans to withdraw by next Tuesday, and the Taliban says it won't extend that deadline for allowing people out. When will New Zealand troops?
So we haven't given specific details, as you can imagine, for safety and security reasons around our specific date of withdrawal, but it is fair to say we do have security concerns. There have been reports that you will have seen around potential threats around the operation, and we are very live to that, and of course wanting to keep people safe. It was always unfortunately going to be a very short window, but we have done the best we can to maximise the time that we had. Thank you, everyone.
Is it fair to say we're not going to stay there without the US?
providing